Starting from like, when you were just starting out as a physician, um, some of your earlier experiences, I think, had a big impact in shaping some of the things that you're doing today. And two of the things that I kind of picked up on, just learning a little bit about you, is that you started going through residency and you were working in a high-paced clinic, high-volume clinic. And this seems to be a relatively common experience. We see articles in the Globe and Mail and other publications as well, but a lot of folks have reported on the emphasis on volume. And I don't want to, there is a bit of a trade-off, maybe volume, quality versus quantity. But if you're kind of pushing for seeing tons of patients in a very short amount of time, can you really give them the best possible care? And maybe this was...
No.
Okay, short answer. I figured, yeah, it's a very challenging thing. And the other piece that I think was part of your experiences was the emphasis on stacking medications, and particularly for very sick patients of various demographics. It could be older patients or patients with multiple comorbidities, multiple chronic diseases. So there are two very prevalent sort of issues at play. And I wonder if you could speak a little bit to how those kind of shaped your interests and where the work that you're doing right now.
Okay. So I was training to become an OB/GYN, done a lot of surgery. My goal was to do infertility, which was so much science around genetics, manipulation of egg and sperm and all that cool stuff and freezing eggs. So the technology part of that subspecialty was really interesting to me. What happened was I decided to take a year off to try to help my parents, who one of them just got sick and had to leave work, and thought maybe I'll just take a year off and help them pay down a mortgage, being a good immigrant child. And when I came out, I worked for a year, then it became 3 years at a traditional family practice office where the volume was insane. And this is where the aha moment, it's like you play it forward. So you're in the office with middle to low income families, which you took care of. And I trained at the University of Toronto at Toronto General Hospital. This is like Mass General, like where you are in Boston. So it's God's gift to mankind's hospital. And any new toy, any new amazing teacher, you got to meet. And then you go out in the periphery, not very far, 20, 30 miles is the Mississauga, Dorian. And there's no MRI there yet. They're raising money for it. And you need to get permission by a specialist or a CT scan. That was almost 30 years ago. I just want to give you some perspective on that. So you go, are you kidding me? All right, so now you're seeing 50 patients a day, and they can only come in for one thing, as if their body was all separated by compartments. All right, so that's not my idea of a good time. Then I went to a nursing home as a part of their practice. And the light bulb went on very quickly in 2-3 months. People who don't take care of themselves end up having strokes, arthritis, diabetes-related issues of blindness, amputation, and they end up in a nursing home because of those things. And I thought, I am not going to be part of this problem. So I left. I left that world, and I said, I'll figure out another way. And so I thought another way would be to get into the healthcare system itself, and that's the reason why I ended up doing my MBA, thinking that I could take it from an institutional perspective. And I guess we'll talk a little about the different pieces of my career. But the bottom line was that the way to start it is to take an example of how to create a integrated healthcare model so that you have other healthcare practitioners who know more about bones and muscles, nutritionists who understand more about diet and nutrition, because 2 courses in a medical school does not make you a dietary expert. understanding the world of supplements, acupuncture, chiropractic, not my wheelhouse, the Western medicine world as well. That's just quackery. And to think about it, traditional Western medicine has been around a couple hundred years, let's be generous. Acupuncture has been around for thousands of years. We can't throw the baby out with the bathwater. So that's that piece in terms of health professionals working with me. But the NBA taught me that you need to leverage the technology. So if you can put where the science and the technology meets and East meets West, that's really what my practice is about. Because I don't want to get stuck in a nursing home. And I think that this is another reason why COVID is going to change how we all look at nursing homes. They're weak and frail. And if you ask yourself honestly and look at your parents or your grandparents, there's lifestyles that cause them to be there. My goal in life is to be a Duracell bunny and just keep bouncing every day, or Tigger, as my child doesn't like Tigger. And then all of a sudden the battery runs out. And then you wake up, you go, oh, so this is what heaven looks like. This is just fine with me. That's really how everybody should be living. Not having the last 5 or 10 years of their life. God help them if they're stuck in a nursing home for 10 years. Slowly degenerating because people can't take care of you because of a complication of vascular issues related to diabetes, stroke, heart disease, arthritis. They're all chronic conditions that, in fact, are somewhat genetically driven, but they're environmentally fueled. So if you know you have a genetic predisposition to this, you need to work your butt off to not get sick because you now know. So there's no excuse to say, I didn't know I was prone to diabetes. I didn't know I was prone to arthritis. That's like taking a pass and saying, I didn't know masks work for COVID-19. It's like, no, you don't get a pass for that.
So that's very refreshing to hear, really. You don't hear those perspectives very often, although they're out there for sure. So there are a couple things I wanted to come back to. One is the piece about genetics and your earlier experiences, and I think that's shaped a lot of the interest that you have right now and the approach that you have to incorporating precision diagnostics into your practice. So we'll touch on that, and also your interest in telomere science, and how that impacts health quite broadly, actually, and how it's based on the Nobel Prize winning work. So we'll come back to that as well. You've been described as a trailblazer, and I can see why. And it really seems to me that you're a lot about breaking down myths and just kind of getting to the bottom of the way things really are, and just tackling the problems head on. And it seems like you don't shy away from doing that. Have you always been like that?
Yeah, I think I have to confess and say proudly so. People have asked me why, and I'm a female. I'm Chinese. I came to Canada in 1969 as a 5-year-old, and my parents were both middle class employees. One, my father was a teacher, my mother was a medical social worker. You know what? They gave me permission to do something. They told me that very, very early on. You're female and you're Chinese, so that means that you got to do things twice as good to get where you need to. But don't ever let anybody say to you, no, you can't. And if you say, no, I won't, that's your choice. But my father's never, nor my mother, have ever said to me, don't do something. Because if it's my passion, they go for it. But make sure you just follow through with it. So I think it makes a difference when your parents support you to be the best you, and make sure that they empower you to do that. So I don't take no for an answer. And if something's wrong, something's wrong. And so either you suck it up and say nothing or do something about it. And I think my nature is I can't suck it up and do nothing about it. I mean, I watch in a nursing home, like, honest to goodness, this is another whole area that we get into this now with COVID. Like, people are shocked that nursing home standards says that you only need to have a bath or shower once a week. Really? So,
Yeah.
and we start from there, right? So these are the things that you kind of go, no, that's wrong. And I really think that now people have to ask yourselves if something's wrong, like the whole world of Black Lives Matter, Seniors Lives Matter, is all coming out, right? So I'm really glad we're going through this turmoil in some bizarre way. We're going to come out as a society that's better for it in the longer run.
And I would agree with that. I mean, it's bringing a lot of issues to light that people know
Mm-hmm.
about, but it hasn't become salient like it has because of COVID. And I think a lot of the
Mm-hmm.
stuff also struck a chord with me. I'm also first generation, and I also have a grandparent in a nursing home in Ontario. So yeah, a lot of the stuff is it really is that way, and there are some challenges that we really need to work through them.